a lot is needed, on the part of government. So ours is just like a reminder to say that people with disabilities are also here, and we need to do everything possible to make sure that they are captured in this campaign. So we will begin with a briefing, a message from the organization, and the secretary of the organization is going to give us the message.
Nigeria wake up to the sad realities of coronavirus in February 2020. More worrisome is the fact that Nigeria, according to Minister of Health, is not prepared for this virus. The World Health Organization, who declared it as global pandemic. Nigeria problem is compounded by poor health infrastructure and absence of budgetary allocation to our health system. Nigeria recorded the first case in February, and today it has increased to more than 10,000 cases, with over 250 deaths recorded so far. The virus is set to spread and increase astronomically in the next 1 month. The fear right now is that the rate of increase may overwhelm the government because of lack of facilities to the care for patients. As a result, there is massive sensitization for social distancing, stay at home, and personal hygiene. But the unfortunate thing is people with disabilities are not properly captured in this campaign, especially the deaf women. People with disability, especially the deaf women, are worse hit by this pandemic. Communication is a big issue in this campaign, especially the rural areas. There is urgent need to design communication materials in alternative formats for deaf people. The urgent need to factor issue of women with disability into the prevention campaign made this project compelling. We are grateful for the support from Urgent Action Fund Africa to put this project together. Under this project, we will design communication materials on COVID-19 prevention for deaf people. This includes 4 explainer videos in sign language, design e-flyers on prevention and management, attach a sign language interpreter to work closely Abuja Task Force team on COVID-19 for briefing and updates for a period of 2 months. We believe strongly that with this intervention, women with disability will have a space in the COVID-19 prevention campaign. We use this medium to once again call on Muhammadu Buhari to set up the National Disability Commission, which he signed into law last year. The Disability Commission will make management of affairs of over 27 million persons with disability in Nigeria easy to manage. This is in line with the United Nations Convention on the Rights of Persons with Disabilities. Once again, we thank you for your coming, and God bless you. Women with Disability of Nigeria Support Foundation. Thank you.
Thank you very much. The organization is a group, made up of sport people, and it's a cross-disability organization. What I mean by cross now means both physically, visually impaired, deaf people, people with intellectual disabilities. And the common thing about all of them is that they are all sport people. So we have noted that one of the challenges that came with COVID-19 is a lot of communication and a lot of information materials going out there. We noted that deaf people at a point are at a loss because they will need to be up to date, with happening in the country, especially when it comes to prevention. knowing fully well that at the moment they are only limited to what is on print. There is need to step up, conversation in alternative formats. So that's why one of the things the organization will do is to send a sign language interpreter to the Abuja task force on COVID-19, to also sign to cover what they are doing in sign language. It's not everybody that have access to what is being signed at the presidential task force on COVID-19. There are lots of people in the rural communities that don't have access to that kind of information. Understand? And at the moment now, government have expressed concern that incidence of community spread, you understand, is accounting for most of the latest figures we have now. And in the community now, we have lots of our deaf people, you understand? So that's why we really need to design information that will get to them in the rural villages. Those that don't have access, because it's not everybody that even watches TV to know. We only have one sign language interpreter at the moment, signing from the presidential task force on COVID. So we need to also deepen it, get it, to other cities and areas. So that's why one of the things we are going to do in this campaign is to also use social media, make maximum use of social media, to advance, the prevention response. It's 3 months program. And part of what we are going to do, we are going to run a 1-month campaign on social media. We'll have a video. We'll have an explainer video, 4 different explainer videos about COVID-19 prevention. And it's going to come in sign language. It's going to come in sign language. And the person that will be signing for FCT COVID-19 response team will do that for 2 months. She will help to sign for 2 months, because FCT COVID-19 task force is responsible for the entire FCT, including all the villages and nooks and crannies of FCT. So she will work closely with them, understand, and also sign for deaf communities in Abuja only. This project is only targeted to deaf people and deaf women that reside in FCT.
No, sign language interpreters are not enough. All the media channels need to create space for inclusive information, communications, and technology. We want to see sign language by the side of the screen, and all the media channels we have, both local and international. And the images on COVID-19 should also be accessible to the blind in Braille format. What about having a sign language interpreter in all the announcements on COVID-19, in all the network news, in all the updates on COVID-19? We want to see it inclusive by ensuring that the formats are visible to those that cannot see very well. They are inclusive and accessible.
Thank you very much.
Yes.